Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by our members who made donations. We'd like to give them a very big thank you. We have to cover the monthly costs of the radio station's software, bandwidth, phone lines and phone calls to be able to continue with the radio show. And thank you for listening. Today I'm joined by Dr. Harpal Bains from the Harpal Clinic in London. Thank you for joining us today.
Thank you. Nice to be here.
Well, I'm sure our listeners are really interested. We don't get many people from England talking about LDN. Could you tell us who you are, what training you've had, and about your clinic, please?
Yeah, so I'm basically a medical doctor. I've been working as a doctor for the past 20 years. And my background is mostly surgical. At one point, I quit medicine for a little while. Probably the best thing I ever did, because it meant that I got out of NHS and it opened my eyes a little bit to what was going on in the outside world. When I re-entered medicine, which was only a year later, I went into sexual dysfunction medicine. So my background in sexual health is actually very strong. So I was working at Marie Stopes and went on to male sexual dysfunction. Did quite a lot of psychosexual medicine as well. So that side of things actually brought me into the whole world of testosterone. At that point, I discovered about this thing called age management medicine in the US. I thought I'll figure out, try to learn a little bit more about testosterone, which seemed to be something that not many people knew about. And that was my introduction into bioidentical hormone replacement therapy. Not something I ever knew about, never heard about it. I went to the US, decided to learn about it, and was blown away by the whole, this whole new science, which to me, like at that point, having been a doctor for more than 15 years, I never knew about this and couldn't believe what was achievable with this. And I knew that I did not have a choice but to do something about it. And I didn't think there were any options in this country. And at that point, I decided to set something up myself. And it has been the most transformative, life-changing experience ever. So it started out with bioidentical hormones, and from then on, I realized that wasn't quite enough, and then I started learning about functional medicine. And so right now, what I mainly do is a combination of both bioidentical hormone replacement together with functional medicine, and the combination of the two is very, very powerful, and LDN was sort of like a natural progression from there. Mm-hmm. So I've been doing LDN, I think about 2.5 years ago was when I first stumbled upon it. And I've been doing it for around that time, about just over 2 years now. And my experience in it has, it came to the point where I was using it for mostly autoimmune MS, Hashimoto's, that kind of a thing, to right now I use it for a lot more indications. Anytime I'm sort of stuck and that there's a patient where I'm trying to buy a little bit more time, I'm using it for those purposes as well. And what I'm finding is that the combination of that together with a hormone replacement basically where there's a deficiency, it's not so much replacement, it's hormone balancing more than replacement. When you balance all the hormones, it basically brings about results much, much quicker than other methods in my experience. And so when we include LDN and the functional medicine and look at gut, look at the brain and heavy metal toxicity, environmental medicine, which is another area I have been going into, it's quite powerful, and we are getting we're getting very good results.
Mm-hmm. Going back to what you said initially about you were in sexual dysfunction medicine, yeah. Do you treat people with sexual dysfunction with LDN?
Not yet. I haven't used that mainly just because I've got so much else up my sleeves for the sexual dysfunction, and because I know what to look out for. And I find that the other things that I do are actually quite a bit more effective, but I haven't really tried LDN purely for that purpose.
Okay. I was just
However, most
interested.
of these people who have it is quite an interesting one actually. But I do find that most people who have the need for, who have sexual dysfunction, especially when it's not age-related organic, they tend to have problems which causes the sexual dysfunction, let's say leaky gut or one of the other things. And I would use LDN on those things, and then as an indirect consequence of it, the sexual dysfunction improves.
I see.
And so in a much younger patient, I know I get patients like testosterone replacement therapy is one thing I do a lot of, and the classic patient for that is usually above 40. I do get people in their late 20s and early 30s, keeping in mind that I'm in the city of London with a lot of traders and hedge funders and people in this highly, highly stressed lifestyle who also have to sort of like entertain a lot for their work. And so I'm getting very, very young people with a lot of these symptoms, and quite many of them also have these other stress-related issues, the adrenal side of things. And LDN works really, really well in those. And so with them, I have to be quite careful with what I do because there's fertility implications for things like testosterone replacement therapy and all that. And so it's like we have to look at every single aspect of them so that when we manage them, it's really the best for them, for their age group, relevant to as short a period of time as possible so that they optimize the best. And in these people, the LDN actually works really well.
Okay. Now, you're talking about gut health, and all functional medicine doctors focus on gut health and leaky gut and SIBO. I myself had SIBO, and I found it very difficult to get treated in this country, and testing and things. Do you focus on SIBO as well, or isn't that something?
Oh, yes, completely. Completely, more and more and more, Okay. Yeah, as I said, my advantage is that because I do the hormones as well, the combination of the two is powerful and quicker. Okay. In my experience, because it's like, with the functional medicine, I'm looking at all of that, of course, because once again, being a medical practitioner, I can do the antibiotic side of things. I'm also very cognizant of the fact that we shouldn't just be attacking all the time and focus a little bit more on rebuilding. And so that's another area which I'm now focusing more on. And with the rebuilding side of things, the LDN is particularly prevalent. So it's not literally a case of antibiotics now go away. No, that's just step number one, if anything else. And then we focus quite a bit on the rebuilding part of things so that hopefully in the long term it doesn't come back. And what I'm finding is that by doing all these different systems at the same time, we're getting a domino effect. And we also do at our clinic, we also do the intravenous nutrient therapy. And when you combine that as well together alongside it, we're actually quite sophisticated in that we're doing all the amino acids, alpha-lipoic acids, CoQ10s, and all of that intravenously. And so when you do it all in conjunction with one another, the domino effect is quite powerful. And so what we are trying to do is trying to plan for people based on their budgets, frankly, and what they can do, where they can do, and we really want to help.
And of course, you are not part of the NHS, so you're a private practice, and people do have to pay for private medications. And unfortunately, that means you have to pay for your own blood tests and any other kind of testing, and then the medication and the consultation, etc. Are you finding testing in this country really expensive, or is it affordable for most people?
It's expensive. I definitely think it's more expensive, because I know quite a lot of the European doctors who work in the UK actually send their tests back to Belgium or whichever country that they're from. And it's like they get a hell of a lot more testing for the same price as what we have to pay here, keeping in mind that I've actually negotiated very, very strongly with our local labs so that the same panel of tests, which I would prefer for my full medical client, so it costs about 400 something for the lab panels, but were you to do it individually with the labs, it would have cost you close to 700 something pounds. Right. So I also think it is really, really, it's really the practitioner needs to negotiate. And so, but it's somewhat cultural from me. I'm from Malaysia. That's where I was born and brought up, so negotiating is fairly cultural for me. So no matter what I do, I try my best to negotiate to get the best price, because in the US, they like to test for every single thing, and because that's where I get all my protocols from. That's where I'm learning everything as well. What I tend to do, and when I came back and when I saw what it was going to cost, I was like, I can't do it. I was like, no one's going to pay for it. Mm-hmm. I didn't think people were going to pay for it, so I had to just negotiate, and it's great. So I think the panel that I do is very good value for money, but it's still more expensive than what you can get in Europe.
Right. And how often do you have to have these blood tests? Is it a one-off or is it every few months?
No. For me, once again, keeping in mind very much a person's budget. It's for some reason a very strong thing for me. I realize that it's not easy. It's expensive for a lot of people, and most people who come in, especially for something like LDN, it's a chronic, it's a chronic situation. They might have been out of work for a while. So what we have actually done is we have our full medical consult where we look at every single aspect of the person's life. It takes about 2.5 hours of my time in total, wow, which is quite a lot. Mm. Yeah, it's extremely comprehensive. It looks at every aspect, really, the hormonal side of it, functional medicine side of it, and every other aspect. For that one, I do ask for a full lab, which is about the 400-something pounds. And after that, my protocol is if someone sees me today, they then have to see me in about 3 months, because it usually takes about 2 to 3 months for things to sort of balance out and reach a nice place. At that point, I then tweak things a bit more, because at the 3-month point, that's when we sort of have an idea of where they are. We can tweak things further or keep things as they are. After that, so it's now month 3 and then month 9, and thereafter for someone who's fairly well annually. I think that's quite manageable for most people in terms of cost. Mm-hmm. And then we have also created a special LDN consultation for people who can't really afford, literally want this, and that's way cheaper. That's under £200. That's very good value. They don't have to do labs. You're happy to accept what labs they have. The only problem with that, once again, is that quite a few of these people come in, and from their history, I know that they are way more complex than what it is. Mm. But what it does do is that it gives them an idea of if they think they will be able to work with me, because that's another underappreciated side of this thing. If you don't get along really well or if you, for whatever reason, you don't feel like the consultant is the right one for you, you're never really going to get anywhere. So in a way, I think of it as a taster. Mm-hmm. They come in here, they see either me or one of my other practitioners, and if they feel like it's a good fit, 3 months down the line, they can very well convert and become a full medical. And even that, we make it very fair, because we don't charge them the whole fee again. We just take away what they've already paid initially. I think that's very fair.
It's very fair. And it's about building relationships and building trust,
isn't it? Yeah. And I'm quite happy that if they feel like they don't have that with me, there'll be another practitioner out there for them. Mm-hmm. But I do, and it's one reason why we have a lot of video blogs, regular blogs and all that, so that by the time they come to see me, they've already pre-qualified me and decided that, I'd like to work with this practitioner. Oh, I do think that's that's important.
It is very important. Is there any way, if somebody was trying to get LDN and wanted to have blood tests and things, but were having to struggle financially, is there any way that you could work with their own GP to try and get some of the testing done on the NHS?
Yes, we do. Mm-hmm. We do. We try, but as I say, for the LDN alone, we actually don't ask for labs.
Okay. But if...
Yeah, I don't ask for labs. So, and that's a cheap consult. Most people can't afford that. Mm-hmm. But it's when they start having hormonal issues and this and that, which about a good 70% of them have it, especially the older patients. Mm-hmm. That's when things become a little bit more difficult, because the whole idea and concept of bioidentical hormones is quite foreign to most doctors even. Yes. And a lot of them think it's bullshit. So that's where I get a little bit stuck. It's a difficult situation. I'm not entirely sure what to do. Mm.
And it was very interesting when I was talking to the medical professionals in England about SIBO. Yeah. Didn't even know what I was talking about. So I was saying small intestinal bacterial overgrowth. Nothing.
No. So, I mean, Hashimoto's is the other funny one. I mean, like thyroid, the number of thyroid patients who have started coming to me, it's actually been extremely interesting. And that's another area where I'm quite frequently getting stuck, because, of course, I give LDN to all my Hashimoto patients. In fact, even those without Hashimoto, to me, it just makes sense to start them on LDN because there's so many benefits. Mm-hmm. And, we test for, naturally for T3, for reverse T3 where relevant, for the antibodies where relevant, and none of this is being done on the NHS. And so it really puts us in a difficult position. But then once we get all of that, and once we look at it from an adrenal perspective as well, and manage their insulin as well, you actually can get really, really good results with these patients. So, so it's a difficult one. It's a difficult one. As to working with GPs, it's really hard.
Well, it's so nice that you are open-minded and willing to learn. I mean, doctors are always having to train, aren't they, to still hold your license. But to do alternative things, outside of the box, outside of the norm, it doesn't mean to say, if you haven't been trained in it, that it doesn't exist. That there are.
Yes, exactly.
There are other things out there. But it's the same thing with quite a few of the doctors we work with in the US, who are MDs, who have been absolutely disillusioned and then have gone on to train in functional medicine. And it's just been like, wow, my patients have been doing so well. Yeah. So
it's amazing. We're starting to see a lot of cancer patients as well recently, who just want that extra level of care, which they, once again with the IV nutrient therapy and the rest of the things that we do. It's just been very interesting, the change in the type of patients that are coming in these days. Like the more sophisticated we are getting, the patient type is changing as well. We have also, as of I think 2 months ago, set up a charity. I haven't done anything about it yet, but I'm hoping that maybe by later on next year, something or other we'll be able to put something into place with. I've called it a Fighting Chance Foundation. It's mainly for people who basically need a fighting chance in life, really, and the idea is, I think, for people, especially chronic diseases and those who are really, really struggling, it's a catch-22 situation where they want to work but they can't work because of, and it's such a difficult situation to be in, and it's hoping to target that section. But so literally at the moment we've just registered a name and nothing else has happened. But I'm hoping within 1 to 2 years we'll get it going.
Oh, that would be really something. And
yeah,
I was talking to Dr. Wei Lu from St George's Hospital in London this morning, and more and more work is being done with cannabinoids and LDN.
Yes.
I don't know whether you watched the LDN 2017 conference. There was a lot discussed about that, using in conjunction. And is that something you use in your practice?
Not yet, mainly because of the supply chain, because at the moment the only registered are Sativex and nothing else. So my patients, most of them, those, especially the cancer patients, a lot of them have cannabinoids, but they source it themselves.
Okay.
And you do get stuff around. It's just not good enough, and they know it, and so they source it themselves. But so it's an area I'm very interested in getting into. I just need a little bit more time.
Okay.
So much.
Yes. And what about diet? I know you focusing on the gut and
important.
everything.
Yeah, hugely important. The basic, once again, it's not really a one-size-fits-all. And so it has to be tweaked quite specifically for the patient. So we have a general rule that I basically follow the the book Nourishing Traditions, Sally Fallon, the Western Price Foundation. So sort of like what our an easy rule of thumb would be, if you see it in a jungle, if you think you'll see this thing in a jungle, you're fine to eat it. If you don't, chances are it's not really relevant to your body. That sort of works for, I think, about a good 60-70% of the patients, and for the rest of them, you have to tweak it, have to take into consideration there. It's not like ketogenic is the way forward for everyone now. It's not quite as simple as that. If you've got adrenal fatigue, it's not a good idea. And then you've got people with all kinds of intolerances, and then you've got the whole salicylic issue, the histamine issue. It's such a complex diet is hugely complex. So I've got a few basic guidelines that all my patients, where when they come in, we do talk to them about it. And then off that, then of course you've got to super specialize. And we try to do as much as we can. We do not have a nutritionist at the moment. So at the moment, all the practitioners who come on board, at the moment it's me and my brother has recently joined me as well. We're hoping to get more practitioners in at some point, but to be trained in my protocol. Mm-hmm. Because it's been, I basically researched it myself, most of it, and created the protocols myself. So at the moment, the practitioner is the one who does everything. Mm-hmm. And I think there's something to be said about that, because you can sort of lose touch as well. And so right now, because they're under our care, we're looking at them from A to Z and not offloading it to 3 or 4 different parties. And there's something to be said about that.
There certainly is, yes. And like I said before, it's building relationships and confidence in people, because your health is just so important. You know, you're not going to trust somebody who you don't really feel you clicked with.
I also think we should look the part as well. You know, so if I'm jumping around, bounding with energy and the rest of it, which I actually am, then, you know, I'm hopefully doing something right, and hopefully you feel the same way about me. And I do think that's an important component of it as well. Mm-hmm.
Exactly.
So,
and if we can just briefly talk about supplements, obviously they have to be tailored to the individual, whatever their requirements are. But if there was somebody who couldn't afford, because unfortunately supplements do not come cheap if you're having quite a regime.
Not the good stuff.
No, not the good stuff, exactly. But if you had to say there were 3 things that you thought the majority of people were deficient in, what would those 3 things be?
C, magnesium, these 2 100% for sure. So as high a dose of C as you can afford, really. And magnesium, that's a jack of all trades. I would say these 2 are like top. The third one will probably be tailored a little bit more to fish oil. It will be for fish oil. Mm-hmm. Yeah. So if I had to pick 3, those would be my top 3.
Okay. And where in your list would vitamin D be?
We inject it, you see. That's the thing. So
really? You inject
I generally recommend people.
Wow.
Yeah, I generally recommend it. Well, it's 4 to 6 times a year, you know, depending on your skin color, really. So if you're darker skin, really 6 to 8 times a year. I just find the absorption is so good. You get, you know, and then you don't have to bother with supplementing all the time. Mm-hmm. So what we tend to do here is there's always going to be people who don't really want to do that, but it's 300,000 international unit of D2. It has to be converted to D3, but still, it bumps your results up so quickly, and you can see the changes so quickly that it's well worth it. To me, it's a no-brainer. So what I tell people is do it a little bit closer together towards the winter months. In the summer months, then you can, taper it a little bit, maybe give it 2 months in between or longer.
Wow.
But the changes are that quick.
Mm-hmm. And the intravenous supplements that you were talking about earlier, I mean, how often do you have to have those? And how long does it take?
The way I explain this to people, so there are a few different methods of doing it. We have of course, the regular B12 and D is the intramuscular one. We've also come up with a B cocktail where it's all the Bs in 1 ml plus the B12 in another. So that's a 2 ml thing that we inject into people. And then we do pushes as well where, we over sort of 15 minutes, we push the nutrients through. You can only do small amounts of things using that technique like glutathione, magnesium, a few other things, and small doses vitamin C. And then of course we have the drips. With the drips, we can do pretty much anything we want and go quite high up as well in a dose. And what I tend to tell people, and I just think this is a general good rule of thumb, if you do it and you feel absolutely great, you probably are really deficient. I will do the next one a bit sooner rather than later. Mm-hmm. If you don't feel that much of a difference, you can sort of prolong it a bit, because we've actually had people. I had a very fortunate experience once of having a lady who was only in London for 2 weeks, and she wanted to do 6 miles during that time. And so watching her was extremely interesting to see what happened, in 6 weeks. So the first 2 or 3 that she did, brilliant. She just fell on top of the world. The changes were quite, and then it started to taper down. And the way I see it is that, she was probably optimized at that point. She didn't really need it. And so this is what I tend to tell people. And then for my leaky gut clients or my fatigue clients, I have a slightly different thing that I tell them. And this is that wait till you can afford to do 3 close together and then taper it off. So don't just do 1, because you just use it all up and you run yourself back down to zero. So what I want them to do is like do one today, but make sure you're able to afford another one in, let's say, 1 to 2 weeks, because then it never ever drops down to baseline. And from that point, do another 2 to 3 weeks. And now you've got a cell that's really pretty healthy and able to work really well. They're able to detox by itself. It's a much more healthy cell. So the domino effect cannot be underestimated. And so for them, I'll tell them, don't do one now. Wait till you can afford to do 3 close together, preferably not more than 2 weeks apart. And then you're in a better place. And once you're more efficient, then even the oral supplements that you take work a lot better as well.
Wow.
So, yeah.
That's so interesting. I'll have to have a talk to you afterwards. I have MS, and chronic fatigue is an issue.
Yeah.
But very, very interesting. Well, now you've told us everything we need to know about you. For people who would like to come and see you, how do they get hold of you?
Oh, we're in the city of London, in Moorgate, between Bank and King's Cross. Really, extremely easy to find. The phone number of the clinic is 0208 616 9130. And just give us a call. But before that, definitely go onto the website. I've written tons of blogs over there, not as much recently as before. There's quite a few videos as well. And we also do aesthetics, because I did not think that this part of the business was really going to pick up till, I gave myself about 3 to 4 years for the medical side to pick up. So I thought in the meantime, I needed to pay the bills, frankly, pay my rent and stuff. So there's also aesthetics there. And just because I'm stating this just because it puts some people off and they wonder why, why aesthetics is seen as not serious medicine. Yeah. But that's frankly the reason why I do it. It is, but I happen to be really good at it as well. So we do it all. So it's sort of like a anti-aging inside and out is kind of like what we do.
Mm-hmm. And what's your website address?
Yeah. It's my name. It's harpalclinic.co.uk.
Mm-hmm. Wonderful. And thank you so much for being such a wonderful guest. I've really enjoyed talking to you.
Oh, thank you. That was fun.
The LDN 2017 conference, held in Portland, Oregon, 22nd to the 24th of September, was a huge success, and the feedback has been excellent. If you weren't able to join us, you can purchase the 3-day live stream recordings for just $80, or the 3 days plus 15.5 hours of recorded presentations, including all the PowerPoints, for $365. All recordings are available for 12 months. CE credits are available for NDs only. For full information, go to www.ldn2017.com.
So happy to be here. It's our second year here. The information gets better and better every year.
Yes, and we've found that the conference has been wonderful to be surrounded by these thought provokers, and we're taking information home that we could immediately implement on Monday.
It brings us into the future, into a very helpful therapy for Lyme disease and other infections, inflammation.
Such an incredibly diverse range of scientists from all different professions that are all focused on one thing, which is helping LDN help the maximum number of people possible.
Phenomenal doctors giving some tremendous speeches.
It's my first year at the LDN conference. It's fantastic, and we're definitely going to be back again next year.
Great conference, learned so much, really enjoyed it.
Yeah, so far, day one, it's amazing. Number one, the networking, meeting people that are like-minded and really wanting to learn.
So it's extremely interesting and clinically useful that you can get down to using LDN and other immune modulating treatments for so many illnesses. And I guarantee it will be clinically useful in your practice.
It's exciting to be here, interacting with people like-minded, open-minded, and what I call big brains. So they are fun to deal with.
What I found really interesting about the conference is the interest in the actual scientific principles of some of the conditions which respond to low dose naltrexone.
So there's some people here who are just incredible in their field, helping with pain, autoimmunity, and they've personally helped me a lot. So that's why I'm excited to be here.
I feel that this conference has given me confidence in writing more, the LDN, with more guidance from thought leaders.
And I flew all the way out to Portland to come to this LDN conference, and it has just been great.
And so it's just really fun to be around peers and colleagues and patients doing it.
The LDN 2017 conference held in Portland, Oregon, 22nd to the 24th of September, was a huge success and the feedback has been excellent. If you weren't able to join us, you can purchase the 3-day live stream recordings for just $80, or the 3 days plus 15.5 hours of recorded presentations, including all the PowerPoints, for $365. All recordings are available for 12 months. CE credits are available for NDs only. For full information, go to www.ldn2017.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.